Hi, I'm Dr. Abhishek Patil, consultant and head of the department Rheumatology, Manipal Hospitals, Bangalore. On this occasion of 5th May, that is World Pulmonary Hypertension Day, I want to speak a few words about this lesser known condition. So when it comes to hypertension, all of us are aware of that increased blood pressure, systolic blood pressure more than 140 or diastolic blood pressure more than 90. This is what we often correlate with hypertension. We are aware of the the symptoms of the hypertension and treatment and other things. But however, this pulmonary hypertension is much less known of an entity. Basically, pulmonary vasculature is nothing but system of tubes that connect your heart to the lungs. What happens is, basically hearts pump blood to the lungs through the pulmonary vasculature, and through the pulmonary vasculature called veins, pulmonary veins, they come back to the heart, only this time purified. So lungs and heart work as a synchronous machine to purify your blood, and that conducting pipes are nothing but your pulmonary vasculature. So you can imagine with the world itself, whenever there is a pulmonary hypertension in which there is an increased pressure in this flow of blood from the heart to the lungs, lungs to the heart, it leads to reduced oxygenation of your blood, and that can have catastrophic consequences. Now, various causes of pulmonary hypertension exist. One cause, which is pulmonary artery hypertension, is because of thickening and narrowing of this pulmonary artery. That is, another cause is if there is any disease in the left side of the heart also, it can lead to increased pressure in the pulmonary vasculature. It could be because of the lung disease, which is called class 3 pulmonary hypertension, and then there is some clots forming in this whole piping system leading to elevated pressure, and there can be multifactorial causes also. But today we emphasize on this pulmonary artery hypertension, in which there is a thickening and narrowing of the pulmonary artery, resulting in reduced blood supply from the heart to the lungs. Thus the oxygenation process is hampered. Now, various causes exist for this condition. Some of them are like the drugs which you use to suppress your appetite, or cocaine and other recreational drugs. It could be HIV, patients with HIV at a higher risk for this condition. It could be some of the connective tissue diseases, meaning autoimmune diseases affecting your skin like scleroderma can also cause thickening of the blood vessels in the pulmonary vasculature, leading to pulmonary hypertension. Or it could be even some genetic mutations leading to this. In a chunk of patients, the cause remains unknown, which is called primary pulmonary hypertension, and this typically occurs in females of reproductive age group 20 to 40 years. Now, the symptoms of this pulmonary hypertension can be quite non-specific. It could be just something like fatigue, dizziness, mild chest discomfort, raising of your heart rate, that is called palpitation. Now, we all tend to ignore when we get these symptoms, right? When we get dizziness, we try to correlate with that I did not probably have enough water, or I did not take rest, or you correlate with low hemoglobin or other things. So that's why the diagnosis gets delayed for this condition in most cases. And in more advanced cases, the features of right heart failure develops because there is an increased pressure on the heart, right side of the heart, which pumps to the lungs, and if the blood flow is not smooth, it results in elevated pressures in the right side of the heart, leading to pooling of the blood in the lower limbs, leading to swelling of the limbs, or enlargement of the liver, filling of the fluid in your abdominal cavity called ascites, or even extreme cases bluish discoloration of fingers because of the reduced oxygenation of the blood. So when you develop these symptoms, your doctors might want to look for this depending upon your scenario. So when pulmonary hypertension is suspected, if there are any underlying condition, for example, I'm a treating rheumatologist, so in a patient with breathlessness, if any patient of scleroderma present to me with breathlessness, I'll always suspect and look for this condition called pulmonary hypertension. So if there's any predisposing factors, or if you are young, healthy with normal hemoglobin, suddenly start developing breathlessness, this is probably one of the things one need to look for. So in such cases, your doctor may conduct appropriate blood investigations, ECG, echocardiogram to detect elevated pressures, and in some cases even right heart catheterization. However, if this condition is detected and treated early, it can have a much better prognosis, much better outcome than if when the signs of right heart failure develop. So with this simple talk, I hope that I'm able to impart some knowledge on you. Thank you.